My name is Banerjee and I'm an interventional cardiologist from Surrey and Sussex Healthcare NHS Trust in the UK.
Hi, I'm Cader. I'm currently based at Kettering General Hospital in the UK, but I was previously working in Bangladesh.
We were very fortunate in receiving an escalator award in the Mentor Match category from Women as One. And as part of that, we designed a 3-part project involving a mentorship toolkit, a mentorship survey, and a mentorship pilot project. So the mentorship toolkit was designed with assistance from friends and colleagues in industry, and in business they seem to be much further ahead compared to medicine in terms of mentorship for women in their profession. So they helped us design a toolkit which we basically piloted on a group of matched mentor-mentees from both Bangladesh and UK, where we respectively worked. We also performed a global mentorship survey that Aisha will tell us about.
Thanks, Shula. We presented the results of the global mentorship survey just yesterday at the AHA, and this was a 33-item online survey that we designed looking mainly at participant demographics, their current mentorship experiences in cardiology, and what they perceived as the ideal mentorship experience. We received 1,210 responses from cardiologists, cardiology trainees, and those looking to apply to cardiology from across the globe. 57% of them had received mentorship at some point in their career, and interestingly, there were no sex or gender differences between men and women who received mentorship. However, we found that there was quite a bit of disparity when we looked at geographic continents. So those in North America, Europe, and Australia were more likely to receive mentorship during cardiology training and their careers as compared to those in Asia, Africa, and South America. We also asked those who did not receive mentorship why they didn't, and one of the main reasons was that they did not have access to mentorship. This was for both men as well as women. When we asked them the barriers to effective mentorship, the main reason that most of them gave was a lack of time and also a lack of training and understanding of the concept of mentorship, which led us to our next question of if they would be interested in mentorship training, and over 90% of both men and women said that this is something that would be of interest to them, which was very nicely in line with the whole mentorship toolkit.
So the mentorship toolkit initially starts with explaining the benefits and purpose of mentorship, as during our pilot we found that there are many incorrect perceptions about mentorship. For instance, the mentors seem to have a failure to understand that there is an altruism in mentorship, in that you're there to really help your trainee, and that's the main purpose of mentorship. The second thing was that mentees should understand that they're not being spoon-fed. This is a process to help them to develop, but they actually need to push forward themselves. So in the toolkit, we discuss the process from both the mentor and mentee perspectives. And we also talk about how to set up the first meeting and provide a template for mentorship. Finally, as part of the mentorship toolkit, we talk about reverse mentorship, peer mentorship, and remote mentorship, which are different perceptions and different ways of performing mentorship. Finally, we should talk about sponsorship. Women are often over-mentored but under-sponsored, and sponsorship is very important, because you can nurture and develop somebody's career, but if you don't allow them to project themselves and actually show them off to the global cardiology world, they will never actually achieve what they potentially could. So in summary, mentorship helps develop your career. As a mentor, it's a way to give back to potential mentees, and it's overall associated with more successful and fulfilling careers. So we would like to wish you all well with your mentorship journey, and wish you all the best in your careers going forward.